Today is April 20th, or as it's now commonly known, 420. But what is 420 and why are we talking about it? Let's get into it. Though the origins are contested, the term is believed to originate from 1970s California, where a group of high school friends used to meet regularly after school at 4:20 p.m. in search of an abandoned cannabis crop. They never found it, but the code 420 stuck, and it has since grown to become shorthand for cannabis culture. 420 has now grown to become a globally recognized day for activism, policy reform, and public discussion around cannabis. 420 is traditionally seen as a day for advocating for the full legalization of cannabis. At Curaleaf Clinic, we see it as an opportunity to celebrate the impact that the plant is having on tens of thousands of medical cannabis patients here in the UK right now. Although significant progress has been made over the past few years, there is still work to be done. Almost 50% of people in the UK are not aware that medical cannabis is legal, and misinformation and stigma continue to be barriers to access. While many of our patients feel comfortable discussing their treatment with friends or family, they're far less at ease speaking with healthcare professionals or government agencies. This has real consequences for patients. That's why at Curaleaf Clinic on 420, we focus on medical cannabis education to help raise awareness and break the stigma. Cannabis has been used for medical purposes for thousands of years. In fact, the first historical documentation of its use dates back to 2700 BC, with the first modern reference in 1840 for seizures. Cannabis has been used throughout the centuries by civilizations such as the ancient Greeks and Romans for religious and medical purposes. It is also rumored that Queen Victoria herself used it for menstrual pains. Today, medical cannabis is regulated to meet strict quality and safety standards. Patients with conditions such as ADHD, arthritis, anxiety, depression, endometriosis, epilepsy, and chronic pain are now able to access medical cannabis legally in the UK. While we've seen significant progress since the legalization in 2018, let's be clear, there's still a long way to go. We're incredibly optimistic about medical cannabis in the UK, but whilst patients still face barriers and stigma, advocacy remains just as important today as it was before legalization. At Curaleaf Clinic, we're tackling these challenges through multiple channels, conducting and publishing scientific research to strengthen the evidence base, delivering education for healthcare professionals, employers, and law enforcement, advocating for policy reforms to improve patient access, creating patient support resources to help navigate practical challenges, working to amplify patient voices and experiences. Every patient deserves the right to be able to access any form of healthcare, including medical cannabis, if it is the right option for them and their health needs. So this 420, let's shift the conversation. Start discussions with friends and family about medical cannabis. Share educational resources, challenge misconceptions. Whether you're a patient, advocate, or simply curious, taking time to learn and discuss is the key to changing perceptions around medical cannabis here in the UK.